Many seniors struggle with getting the nutrition that they need, and that can affect their health and mood. InnovAge Colorado PACE isn't just about healthy meals. Dietitian Melissa Mayer works closely with participants to make sure that they eat well, stay social, and feel cared for. She joins me now in the sponsored segment to share more. It's so good to see you.
Yes, thank you so much for having me.
This is such an important topic. Melissa, for those who really don't know what PACE is and how it supports local seniors, can you give us a quick explanation?
Yeah, of course. So PACE stands for Program of All-Inclusive Care of the Elderly. So we're supporting seniors in our community to be able to age in place or live safely in the community independently for as long as possible.
And a lot of people may not realize, but many seniors, PACE actually provides their nutrition, provides their meals, provides those social and economic seniors that are challenged, correct?
Absolutely. So we're supporting them in so many ways, from bringing them into the center so that they can have a meal with us. We serve them at breakfast, we serve them at lunch, and for many of our participants, they're relying on programs like food stamps. So budgets are tight, or maybe their motivation to cook for themselves is not that great.
Right.
So they get to come in and have a meal that's both supporting their general well-being as well as their socialization.
Yeah, somebody has to take care of them if they're not taking care of themselves. And all of this is very comprehensive. This is a very detailed program. How do you plan meals, and what else is needed to meet their unique and specific goals and needs?
Yes, absolutely. So all of our meals are planned by a registered dietitian and reviewed to make sure that we're meeting things like enough fiber, enough protein, a variety of fruits and vegetables. So we're looking at a balance of options to make sure that we're meeting a variety of needs for all of our participants.
It's not just about nutrition, though. We should also talk about their experiences. How do the eating together kind of affect their whole mental state, their whole emotional state? You're really doing something good for these seniors.
Yes, absolutely. I mean, we can look at the statistics and see that people generally eat more when they're in a social setting or kind of that family dinner option. But logically, you think about it, it just makes sense. You're sitting with your friends, you're kind of bantering together, you're taking more bites, so you're just generally going to eat better.
And be happy, too.
And be happy, yes.
We had a chance to visit the Aurora Center and to talk to some folks, so let's take a quick look.
I don't know what I did before I met Melissa, because she has just helped me so much. And I went through a time when I was losing a lot of weight. And I fear weight because I was so big at one time. And so it was great to have somebody right here where I was going that could talk to me about food. I know that InnovAge, I know that a dietitian knows what I'm eating. I know that it's healthy for me. And I know that if it's not healthy, the dietitian Melissa is going to find a way around that I can do that will get me back on the track that I need to be. And I don't know. I have a hard time talking about InnovAge without crying, because they just changed my life around so much.
You have a lifelong friend there for sure.
Absolutely.
I mean, what you do is wonderful, amazing, and like she said, it makes her tear up a little bit. So people may think dietitians, you just plan the food, but what you do and what you provide is actual personalized coaching, and it's called a medical nutrition therapist. Tell me a little bit more about that.
Yeah, so that's a common misconception when you think about a dietitian. A lot of people think, oh, I'm going to get a meal plan and I'm just going to follow it. I'm going to obtain whatever health goal. What we're actually doing is coming alongside participants and we're coaching them. So that's where the therapy comes in. We're looking at the medical picture. We're looking for their diabetes. What are their lab scores? We're coming up with those individualized recommendations. Oftentimes when I'm working with participants, it might be as simple as making a recommendation to work on an increased water intake goal or a reduction of sugary added beverages.
So it takes a team. Like we have less than a minute left. I want to talk about the team of experts that you work with, because what happens because of all that teamwork and what you do for these seniors?
Yeah, because of the teamwork, I can get a referral from their InnovAge PACE medical provider to look at their cholesterol and focus on diet changes that they might need to make to improve those numbers before they're ready to start on a medication. I might work with the occupational therapist because somebody is having a difficult time feeding themselves independently, and they can come in and help them with adaptive equipment. Ultimately, the participants are the most important part of the care team, so I want to work with them to help them achieve their goals.
I can see this means a lot to you. Thank you for coming in.
Yes.
I appreciate it. Again, the InnovAge team is happy to help you evaluate your options, see if you are eligible for the program, and share more on how PACE can fit your particular healthcare needs. Learn more. Reach out to InnovAge's center staff in your area. They are certainly happy to give you and your loved ones a tour. You can also visit InnovAge.com for more information. Thank you, Melissa, for coming in. And thanks to InnovAge PACE for sponsoring this segment.